Junie Benerjee-Stevens is a licensed psychologist and owner of Deer Park Counseling and Consulting. She is committed to helping individuals, organizations, and communities heal from trauma, one relationship at a time. What I love most about Junie is her heart and her passion to heal. She just radiates love and compassion. I am so excited to have her here in our community as one of our local healers and here to join us today to share some of her knowledge and her warmth and her passion. Please join me in giving a warm welcome to Junie.
Thank you so much, Danelle. So my heart is beating out of my chest. I'm like, how is this possible to be this nervous when none of you are even in this room? But I feel so hopeful and inspired. And I have to thank Kelvin so much. I was a musician in my past life, and you've reminded me that I need to go home and practice flute, because it is, like, for me, the fastest way to get to the gods, right? It is the best. So, all right, I'm going to share my screen with you all so we can get started. But this has been already such a wonderful experience. So I feel like, you know, ready to get to work. Okay, so what I want to do is just give you a little bit of a taste of some of the work that I've been doing. I actually left Chico State pretty recently. I was the clinical director of the counseling center there, and I loved what I did there. I worked with students, and you know, what I feel like is I helped them kind of see them at their best, themselves at their best, and it's an awesome job doing that work. But I have to say that after the fire, I felt a real call to serve the community in an even bigger way. So why am I here today? Well, let's see, because Danelle asked me to. Is that a good reason? She asked me to come and speak to you a little bit about what I am working on here at Deer Park. Trying to create some trainings that will help us, you know, move toward this resilient community that we know we can become. And this is kind of one of the things that I realized, which has been the theme of the whole day, is that relationships are at the heart of how we become more resilient. And it was fun for me to hear Aaron, because I'm from Lincoln, Nebraska. So I was like, oh my gosh, does he know about Runza's? And does he know about Valentino's Pizza? It was very fun to hear him talk about relationships from where he was sitting in Nebraska, because that's really where I feel like I had, you know, not just a few adverse experiences, but a lot of positive childhood experiences as well. So I'm here to talk to you today about what the role emotions play in helping us become more resilient. And so let me tell you a little bit about this presentation that I'm here to give you today. So at Chico State, we used to do these First Friday sessions where we would talk to our fellow colleagues about what we were doing and what we did in each one of our units. And they asked me to do a presentation on kind of the art of helping. And so I, did my normal helping. I thought, okay, I'm going to do the helping versus rescuing presentation. So, the first thing I do is I show a picture of, what helping looks like. Presumably this adult type person is helping this child type person learn how to swim. And then here's rescuing, right? So in this picture, the person in the water likely cannot make it to that ship on their own. So we need to rescue them, right? So there's helping versus rescuing, right? So helping is assisting someone to do something that they one day can do for themselves, where rescuing is doing for someone something that they cannot do for themselves. But here's the thing, y'all. Like that makes it sound like it's so clear, but it is not that clear, right? So every time I do this presentation, I get all like, my head just gets all screwed up, because I have to think about boundaries and what are healthy boundaries and what are unhealthy boundaries. And my family's from India, and like, I don't even know how to say in my family's language, that's none of your business, because that was never said in any of the circles. that I was around with other family members. So boundaries is so complicated. And how do you know if you're helping when you should be rescuing and vice versa? And then I saw this truck driving to work. Well, it wasn't exactly this truck, but it was a truck with, some of you have probably seen it around here in Chico. It has a stick figure plunging a toilet. And I was like, I hope people don't call the plumber to plunge their toilets, because that's a lot of money, right? To just plunge your toilet, when we all could, figure out how to learn how to do that. And so I went up to my colleagues at the counseling center. I said, do y'all call the plumber when you need to plunge your toilet? And they're like, don't judge me, Junie. I didn't have a plunger when I first moved to town. So yes, I had to call a plumber. And then I was like, oh yeah, I remember now. I was living in a co-op in a residence hall when I was in college, and the toilet got plugged up and I didn't know what to do. So I'm like standing in the hallway just trying to figure out what to do. And this guy comes in and he brings in a plunger, and he like asked me what's wrong. And I said, well, I backed up the toilet. And so he like went in and he helped me and he plunged the toilet. And I was like, oh my God, now he knows I poop. This is terrible. This is horrible. But I figured he had skills. So I married the guy, right? So 27 years later. And I think what happened is that I realized that for him, he had no issues with poop, right? Like for me, it was like a really, horrifying prospect that someone would be like in the same kind of proximity as, some of the bodily functions that I would have. But for him, it was like not a big deal. Like, what's the problem? And then I realized, oh yeah, everybody does it. I mean, it's not like any of you in this Zoom-a-room meeting has figured out how not to poop, right? And then I also remembered that my uncle, this is my uncle, and he's a colorectal surgeon, and my kids call him the butt doctor. And he tells us every Thanksgiving, I don't know what we're going to do this year, because every Thanksgiving we all make a list of our pooping questions, and he sits with us patiently and he answers them all, and he gives us lots of good advice. For example, there are lots of things you can do to keep your bowels moving and to get things, working just right. He says, don't push it. Don't push. If you don't need to go, just, get up and it'll happen later. Don't worry. Don't worry if it's not exactly what you thought it was going to be when you went to sit in there. He says, your poop is giving you lots of important information. It's data. It's really important data that's telling you something about how your body's working, right? So, yeah. Okay. So what's my point here, right? So it occurred to me that poop is a lot like feelings, right? So this is a metaphor, right? So it occurred to me that the pooper can be you, it can be the person you're working with, it can be anyone in your family, it's any of us, right? The plumber is whoever happens to be in that helping role, right? The plunger are all those tools that will help the pooper cope with their feelings, right? And the pipes are all those institutions, systems, families, work, anything that kind of has the potential for getting plugged up, right? So this is now the point in the presentation that I really wish I could see you all, because either you've all decided this is just like a bunch of craziness and I don't want to have any part of it, or it's like, I never thought of it that way. So I'm hoping it's the latter, because now I'm going to drive this metaphor into the ground for you. Okay. So how do I know that poop and feelings are very similar, right? So I'm going to ask you just to think to yourself, which of these feelings is bad and which of these feelings is good? And by now, you're probably all on to me, right? But I'm wondering if you can agree that some of these feelings we have been taught to believe are good, and some of them we've been taught to believe are not so good. Correct? Right? And most of you would say that probably all of them are bad except for glad. Right? So this is, I think, what's starting to make sense to me is that somehow we have to unlearn. Somebody told me in grad school, you can't really unlearn anything. You have to learn new things, right? So somehow we have to relearn or relearn or learn something new about what feelings, the purpose of feelings, right? So this is the truth, y'all. And there are very few things that I know for sure in life because I'm not Oprah. But here, feelings are neither good nor bad. They're data. And they give us information about what we're supposed to do next. The problem is that we invalidate those feelings because we judge them. And this is where we get into trouble, right? Are y'all with me? So here's the thing. I'm going to show a short little video. I think it's worth the 2 minutes that it takes. This is Marsha Linehan, and some of you may know her. She's a psychologist who has done amazing work working with folks who have been shown to have difficulty regulating their emotions. Maybe they're engaging in self-harm or an eating disorder, but I'm just going to let her explain the function of emotions. And I just realized I need to make sure that I want to make sure that I got the sound correct. Okay. So if there's problems hearing this, somebody please speak up right away.
If you look at an evolutionary point of view, why do we have emotions? Okay, so what's the function of them? Okay, the first function of emotions is that they motivate behaviors needed to solve common problems in evolution, essentially. That's what it is. So they motivate the behavior, okay? Second, emotions communicate. They communicate to others, okay? And the third thing they do is they communicate to yourself, which they say to you, check this out. In a sense, they're a rapid fire system. So, for example, if you have something dangerous coming towards you, if you have to sit around and analyze whether that's danger, what should I do in danger? Should I run or should I not? Should I hide or should I not? By that time, you're dead. Or think of the tsunamis that came when the ocean came up, and you see your children down there, and you know right away, you're motivated highly to get those kids out of there so they live. However, you go down and you say, okay, children, I think we should run. Okay, that's not communicating an emotion, and you're unlikely to get them to run. What gets them to run is when you say, run! So it's an automatic communication system. And then the other is, you know, parents have this all the time. They look in a room with their kids and they start thinking, okay, something's going on here. I don't know what it is, but something. And they start checking everything out. So emotions do that for you. So this gives you a lot of information, though, about why it can be so hard to regulate emotions. If you've got an emotion that when you go to communicate it, no one listens to you, or you get invalidated, you have to ask yourself, what would you do? What you do, if you think it's important, is you escalate. But the other person, if they don't agree with you, when you escalate, what they do is they also escalate their invalidation. So you end up in these situations where emotions start going up, mainly because they're not getting validated. Parents always think if I validate it, you'll go up, I'm reinforcing you. But it's exactly the opposite. If you validate, they go down. And they go down because of this evolutionary function of emotions.
All right, so I just think that she does a beautiful job of helping us understand the importance of learning to validate our own emotions and other people's emotions. Because if we don't validate, we're likely to not feel like our needs are getting met. And that's exactly what emotions are for. Emotions are data that help us understand if our needs are getting met. So what I always tell clients and students and people that I work with is that the more distressing emotions are designed to tell you that your needs are not getting met, and the less distressing emotions are the ones that are trying to tell you that your needs are getting met. And yet, when we say that these are emotions that are bad, therefore I don't want to feel them, we cut ourselves off from understanding what those emotions are trying to tell us. And I think this is exactly what we need to understand if we want to create a more resilient community, that all of these feelings are trying to tell us something, right? Like if you're angry, it means your boundaries are being violated, and we need to listen to that, right? So how did we learn to judge our feelings, right? So we learn to judge them. They're bad, right? So we like to spray a little spray to make that stinky stink go away, right? And we do the same thing with those emotions that are more distressing, right? We say, no, thank you. I don't want to smell that. So I'm just going to have you think for a moment, how are feelings expressed in your own family? You know, what messages did you get about some of those feelings? What response did you get when you did express some distressing feelings? And what feelings come up for you when you see someone else in distress? We've got a lot of helpers here today, right? So what happens when you see somebody suffering, right? We all have a reaction to that, and that's a good thing, right? Like it provokes us to do something. It provokes us to take action. Also, it may make us rescue when we should be helping, right? So you don't need to know the slide. There's no quiz at the end of this, right? But there's this whole concept that we have in psychology called countertransference. And what countertransference is, it's when somebody else is having a reaction or having, maybe they're experiencing some distressing emotions, it's going to have an effect on me. And based on kind of the experience and the, whatever I come to the table with, I might have an automatic response. And so one thing we do in grad school is we spend a lot of time thinking about like, okay, am I reacting this way because it's what's, in the client's best interest, or is it because I'm uncomfortable, right? So what does that look like in my poop metaphor? I don't mind if you have a little deodorizer in your bathroom, in your guest bathroom, right? It makes everybody feel a little more comfortable if they can kind of spritz that after they've done their business, right? Countertransference is when you spray the poopery, you spray the air freshener, and then you still light a match, right? So because you are so distressed by the smell of that poop, those feelings, for whatever reason, make you feel that uncomfortable that you want to make them go away no matter what. And this is how we teach ourselves and others that some of those feelings are not acceptable. They're bad, right? So then that brings me to, how do we plunge the toilet? How do we actually start to learn how to sit and stand in some of that distress in order to maintain the relationship that we need to become more resilient, right? To kind of move to the next level. Step one, we've got to actually be able to identify what we're feeling, right? So what I always encourage folks to do, just like Chow was having us do when she was doing those meditations, or even listening to the music for me, I was nervous, y'all, and I was worried about what you would all think of my presentation here, but I was trying to check in, what are you feeling, right? And this is the point where people are like, I feel good, Junie, I feel bad. And I'm, but I just told you that good and bad aren't feelings. So if you don't know where to start, at least start with this: mad, sad, glad, scared, right? So if you can identify what you're feeling right now, and then I'll ask you, where in your body are you feeling that? And then I'm just going to ask you to kind of sit with that. So there's no judgment. I'm not going to ask you why you feel that way. I'm not going to ask you, like, how do we make that feeling go away? I just want you to kind of observe it, right? So what we're trying to do is go from judging a feeling to just validating it. That feeling is trying to tell me something, right? Step two, we're going to try to change your brain. And again, the best thing that we have right now that we're seeing that can really help us change our brain so that we can do a little less judging is mindfulness. So again, if you can stop and pause for just a moment to observe the feeling and go from like a mindless expression of that feeling to a more mindful understanding of the feeling or observation of the feeling, that is a huge step in being able to regulate and tolerate some of those distressing feelings. And then step three is, we got to cultivate some compassion, y'all. And what I'm more concerned about right now, I know for a fact, just because I've been looking at the chat and I've been seeing all your faces, this is a very compassionate bunch. But what we need maybe to spend a little bit more time on, because I think it's going to be critical in the months ahead, in the years ahead, really, is self-compassion. And so if you don't know Dr. Kristen Neff's work on self-compassion, I highly recommend, encourage you to take a look at it, because she is really encouraging us to learn this process of self-compassion versus self-care, right? And I saw that Anna put in the chat at one point, you know, we want to kind of create this community compassion as well, right? This kind of culture of compassion. And so Dr. Neff talks about these three components. One is self-kindness, that talk to yourself like a best friend would talk to you, right? Or I try to remember, like, anything that I say to my kids, that the compassionate, nurturing thing I would say to my child is also something that I probably need to hear, right? Understanding that we have a common humanity. So if somebody else is struggling with something that doesn't feel that hard for you, I can probably relate to that person because something else was hard for me that wasn't hard for them. For example, plunging a toilet, right? And then also practicing this whole, this idea of mindfulness, right? Which comes from a very Eastern philosophical point of view that really helps us understand that, that being present and mindful of what's going on with you is going to be the first step to not judging it, first of all, and then having that sense of compassion for yourself and others. Okay, so what gets in the way of that is real, y'all, right? Like, you can go to Pinterest and find lots and lots of infographics like this that tell you how the right way to do things and the wrong way to do things. And so what gets in our way of being compassionate, self-compassionate, is that we immediately, again, going to that judging ourselves place, right? So for me, I'm working really hard on trying to do the self-compassionate thing, which is trying to embrace the both and, right? We happen to binge our favorite TV show this weekend, right? Does it mean that that my family and I are bad people? I sure hope not, because it was kind of fun just sitting there and watching Harry Potter for, 8 hours straight. So the more that we can be compassionate with ourselves, the easier it is to be compassionate with other people. And this is a huge part of being able to stand firm with folks who may be having a distressing moment, right? So in summary, this was really fast. I usually take about an hour and a half to do this presentation so we can have some discussion. So I hope it brings up some things for you that you might share with family or friends today. But in summary, really going to encourage all of us to observe rather than judge our feelings, to develop those skills of observation through mindfulness and maybe meditation if that works for you. For me, it's also doing things that feel meditative, gardening or playing music, anything that kind of brings you to that present moment. And then certainly cultivating more compassion for yourself and others. That's going to be a huge part of this process. So, and then you just repeat that over and over and over again, right? So when should you call the plumber? Because there are moments that it is important to call the plumber. So let's say you've never done this before. And so when I'm saying in this case, the plumber might be a professional helper, like a therapist, right? So if you've never engaged in, the process of introspection and learning how to understand what your feelings are trying to tell you, it can feel scary. It can feel that distress that you might feel might be overwhelming. So if you've never done it before, if you don't know how to plunge a toilet, no shame in asking for some help. What next? So if you can't identify the clog, sometimes it helps to go to that professional to get a little bit of, perspective, right? Oh, these might be the other factors that I didn't even consider that might be clogging my pipes, right? Perhaps you're not sure what kind of plunger to use. I did not know that there were 2 different kinds of plungers. That might be why it never went well for me until I met my husband, right? So sometimes, a professional helper can help you figure out which tools to use and which tools would work best for you. And then sometimes there really is just too much poop. So this is, some of you remember, this is the mayor of Puerto Rico after Hurricane Maria several years back. And she was literally wading through raw sewage trying to get her folks out of there and to safety. So in the land of mental health, you know, what does it look like when there's too much poop? If you are having some distressing thoughts that actually are leading to thoughts of dying and wanting to not, you're losing some of your reasons for living, which is something that, you know, is really real, y'all, especially in this time that we're entering of more isolation. If you get to that point, that certainly might be a time to get some help from a professional. So final thoughts. Thank you for giving me this time to talk to you today. I just want to say that I was listening to Brene Brown's podcast. If you don't know it, Unlocking Us, it's really good. And she was interviewing Joe Biden, and Joe Biden had just said this wonderful thing that his mother told him that I thought, oh, this is such a good way to end this presentation. She said to him, you have to have courage or you can't love with abandon. And when I think of courage, I think of it can be one of those distressing feelings, right? Because it's scary to stand in fear, right? But we have to have that courage to stand in the fear of maybe somebody not liking me, or maybe having to be in the same space with somebody I don't agree with. That takes courage so that we can love with abandon. And I don't know about y'all, but I know that in Butte County, I think we're ready for some love with without, you know, with total abandon. And I know we can do it. I know we can do it. But part of it is like, let's learn how to, you know, interpret the data that our feelings are trying to give us. So that thus concludes my presentation. I wish I were there with all of you, because if I were, you'd all get like a teeny tiny little plunger to remember that feelings are data, and they are neither bad nor good. So thanks so much for having me. That was record time. I'm impressed with myself.
Oh, Junie, that was perfect. And I want my plunger. That's awesome. You are such an inspiration and really just truly a gift to our community. And I am so grateful not only to have you join us today, but that you choose to serve right here in our community. Thank you so much.
You bet.
That was great.